Good evening, I'm Mariya Stepanova and today we're going to speak about the health news. Joining us today, Dr. Jordi Toyonaga. How are you today?
Very well, thank you, Maria.
So we're going to speak about new eye surgeries, like new technologies in eye surgeries. So what can you tell us about new technologies or new innovations?
Well, the exciting thing right now is the use of lasers for refractive surgery. And refractive surgery is the technique to help somebody who wants to get rid of or reduce their dependence on glasses.
So what's so new about it? Like, what's so exciting?
So with using the laser, before they would cut the corneal flap, what you do in laser surgery is you use a laser instead of a blade to cut the very top layer of the cornea, and then you lift the flap, you laser the tissue away, and then you bring the flap back down. And what's really exciting about laser surgery now is that it's much less invasive, it's safer, it's more precise than using a blade.
So was laser used before in eye surgeries or no?
Yes, laser's been used a lot for retinal issues, for cataracts, and for glaucoma.
Okay, and was invented, or the first operation was like when?
They started using laser surgery about 10 years ago.
And they only came up for this kind of surgeries only like now?
Yes, it's pretty recent. Yes.
Okay, and who is it aimed for? Like what category of age probably?
This age group for laser surgery is best suited for anyone in their late 20s and onward. And up to about maybe 40-ish is best.
So after 40 it's useless, we can say?
No, the laser surgery itself is still very helpful for somebody over 40. It's just the refractive procedure itself is more suited to a younger population.
So what is actually for this refractive procedure?
For reducing the need for glasses.
So is there any chances that on base of this surgery we can, the doctors can come up with the ways to actually help to improve the sight?
Yes, actually in some cases, vision after surgery is better than before surgery, best corrected vision.
And is there any chance to do it for more elder people?
Yes, they're working on that technology right now for the older population.
And what's your prediction? Is it possible actually?
I believe so. Technology has changed quite a lot, so yes, when you see me going for surgery, then you'll know it's safe.
Okay, so what can you tell me about the importance of this innovation? How important it is for our days?
The real benefit of laser surgery, as I said before, is its safety. You know, when the surgery was done with the blade before, if something went wrong during the procedure, the person had to go home and recover for 2 weeks, then come back and have the flap recut. And now with laser surgery, they've simply put the cut flat back down. The patient will go to the waiting room, wait 15 minutes, come back in, and they can retry again.
And so there is no after hospital layout or something, you should go straight home?
Yes, you go home that day. The actual procedure takes maybe 5 minutes. You wear a patch, you go home, and right after the procedure you're seeing 20/20, you're seeing amazing without your glasses.
And should you do something afterwards to improve it, or to some procedures, some meds and some drops or something? Or it's just one surgery and that's it, you are seeing the best you had?
Yes, the drops that are used really are to lubricate the eye, make sure the eye is moist, and an antibiotic to make sure that no infection gets into the cornea while it's healing.
So do you think if you made the surgery in your 20s, 25 for example, and there won't be any need to do it once again in 40s?
Yes, that's a great question. There is sometimes a need that's called regression, and that's when the person becomes nearsighted again, and then they may need another procedure.
And there's no something against it to do this surgery 2 times? I don't know, some complications which came up later, or it's completely safe?
Yes, it is completely safe provided there's enough corneal tissue. If the cornea is thick enough, then they can take away tissue. If the cornea is too thin to start with, then you have to be very careful because you obviously will weaken the cornea too much.
So before you're doing the surgery, you should actually come up to the doctor and have the procedure of checking if it's okay for your eyes?
Right, absolutely. Yes.
So, and this is just one time. You just came, the doctor looks at your eyes and can say, okay, come on, you can go and do it?
Yes. Yeah.
So there's no like complicated, steps or something?
No, the only thing that the procedure can be done on the same day that the patient, if they walk in off the street and they
That's
want to have it
great.
done, they can have all the testing done and the procedure can be done on that day. The only caveat to that is that if they wear contact lenses. If there's any contact lens wear, they must be out of their contacts for weeks to months.
Oh, 2 months. And depending on what? I mean, from week to months for some people?
Yes, so if you're wearing, say, a soft daily wear, daily disposable wear contact, then maybe it's going to be a week. If you're wearing a hard contact, it could be a couple of months. So it really just depends on what type of contact you're wearing.
So, and where would you can do the surgery? Like everywhere, or there is special hospitals or places?
Laser surgery is done at an independent clinic. So it's very important to find a clinic that's reputable. You have to check the reputation of the surgeons, how many surgeries they've done, what kind of laser they have, because there's many variations like anything out there. There's could be very good, skilled professionals using very highly technical or precise lasers, and then maybe not so good.
So can you give any tips how to look for that, probably for some doctors or for some clinics?
Yes, the best thing would be to go online and do your research. Talk to people who have had it done. Go online and look at the CVs of the surgeons, and they will tell you how many patients they've done, where they had their training. You want to go to a surgeon who maybe does this strictly, as opposed to a surgeon who does refractive surgery plus cataract surgery plus retinal surgery and kind of a jack of all trades. You want to have someone who specializes in laser surgery, refractive surgery.
So you think it's better to go for somebody who's doing only this kind of surgery than for somebody who is mapping up with all of them? I mean, like jumping from one to another?
I believe so, yes.
Yes, okay. So, but if it's kind of new one, won't be so many doctors who actually specialize on this one because it's only a year or something, yes?
Right, yes. And as time goes, like any technology, it's going to become better and more refined. More people will be doing it and be trained in it, so you'll have more options. So with like any new technology, really you have to do your research and make sure that you're comfortable with it, because the longer it's around, the safer and more accurate it will be.
Okay, great. Is it painful?
Is it painful? The actual procedure is not painful at all because you're frozen and they give you medications to take away the pain. So the actual procedure is nothing. Afterwards, there's a little discomfort, yes. I wouldn't say it's painful, but it's not comfortable.
But you're conscious during the operation?
Yes, you are.
Oh my god, I think it's so frightening to see that something is going on with your eyes. Oh yeah. So, can you give some predictions in the technologies in surgeries, eye surgeries in future? Like, how do you see the future of eye surgery?
Well, another big exciting surgery that's coming up now is the ability to do laser surgery for people who have the need for reading glasses, so presbyopia. So again, now this older population. So now they're using laser surgery so that people do not have to wear reading glasses. So that's really exciting.
That's so great. And how is, I don't know, on what stage it's now? Like, are they actually doing some, I don't know, like experimental surgeries, or just research for now?
It's been approved by Health Canada, so there are centers that are doing it now.
Oh, and they're successful? Are there successful operations, you mean?
Absolutely, yes. But again, it's new, so I'm waiting before I have this surgery done.
Okay, and one more question, like, is it only in Canada? Like, it's really big in here, but do you think there are other countries where they're already, like, like, ahead of Canada in this kind of surgeries?
Yes, this surgery has been done all over the world, so it's not just Canada alone.
But I mean, like, somebody is ahead of Canada, like, I mean, or are we, like, first place?
No, we are not first place, unfortunately. We do have some amazing surgeons here who are at the leading edge of technology. I would have to say there's some in the US and in Europe as well. There's some centers that maybe are a little bit more advanced. And that's due a lot to the laws in each individual country and what the surgeons are allowed to do.
Okay. And are these centers working together? I mean, like European and Canadian ones and United States as well. Are they cooperating in doing some new innovations, some new technologies, or they are all separate and by themselves?
They're all pretty separate. I mean, the community does share information, but you know, everybody wants to be the first one to come out and patent
Obviously.
something and make money off of it, so it's not a totally cooperative sharing of information.
Okay. Thank you. That was nice speaking to you.
It was great speaking to you. Thank you.
Thank you.